Remember the shocking news that set social media ablaze? The day Poonam Pandey died and rose from the ashes. Our mission, the same as Miss Pandey's. We're here to shed some light on the silent killer, cervical cancer. But here's the twist. We're ditching the fake obituaries and the death-defying comebacks. Stay tuned, because this is where awareness meets action and you can save a life with just a click. Hello, I'm Dr. Varshini Srinivasan, and like I said, we're going to be talking about cervical cancer today. It's going to be a two-part series, with the first video covering the basics of cervical cancer. What is cervical cancer? It's cancer of the lower part of the uterus, also known as the cervix. This is the part that connects the uterus to the vagina. What are the risk factors for this particular cancer? The most significant one is HPV, or human papilloma virus. This is the type of virus that can be spread by skin-to-skin contact, especially during sexual intercourse. Types 16 and 18 of HPV have known to cause most cases of cervical cancer. The next being smoking. Smokers are twice as likely to get cervical cancer. If you have a weakened immune system, such as when conditions such as AIDS or HIV, or if you're on immunosuppressant drugs, that also slightly increases your chances of getting cervical cancer. How do we know if we have cervical cancer? What are the symptoms? Here's the tricky part. During the early stages of this disease, the symptoms aren't very noticeable. But as the disease progresses, the symptoms that you may find include vaginal bleeding that's abnormal. It could be right after you've had sexual intercourse, or bleeding between your periods, or even after you've reached the age of menopause. It could also be in the form of abnormal vaginal discharge. It could be foul smelling or a different color. You could also have pelvic pain during intercourse or even otherwise. What are the prevention strategies? The first and foremost would be to get ourselves vaccinated. We'll go into the details of that in the next video. The next would be to get regular screenings done. We will also touch on that in the next video. It would also be to quit smoking. That not only decreases your risk for cervical cancer, but also a lot of other cancers. Not to forget, practicing safe sex using barrier contraception is an effective way to decrease the spread and transmission of HPV. If in the unfortunate circumstance that you have a suspicion of this disease, your healthcare provider will probably have to do a little more to diagnose the disease. They might perform what's known as a colposcopy to magnify and look at the lesion, and take out punch biopsies to confirm the diagnosis. If you do have the disease, there are various treatment options. It's not one size fits all. Your healthcare provider will decide on the treatment based on your health and at the stage at which your cancer was at diagnosis. If it's an early lesion, surgery and surgically removing the abnormal growth might be enough. But if it's in the later stages, you might need chemotherapy, radiation, or immunotherapy. So I hope this video talked about all the doubts that you had in your mind about cervical cancer, covered all the basics. Please let us know in comments if you have any other question. We'd be happy to answer this. And stay tuned for our next video that dives into detail the vaccination schedule, when you should get vaccinated, at what age you should get vaccinated, and also the screening protocols for this particular disease. Like, share, and subscribe. Thank you for watching.